the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:24. Every year in the U.S., more than 480,000 people die from tobacco use and exposure to secondhand smoke, making it the leading cause of preventable death in this country. Tragically, each day, thousands of kids still pick up a tobacco product for the first time. Baptist Health's Dr. Devon Ballard with Sherwood Family Medical Center is here to help provide even more facts to convince you to quit smoking. Good morning to you, Dr. Ballard. You know, we hear a lot about, and you think people know all the dangers of smoking, but as we just mentioned, there's still people that are doing it and still new kids that are deciding to take up the habit. So first off, let's talk about what's in a cigarette. It's much more than just tobacco and nicotine.
Correct. Like every time a cigarette's burned, there's over 7,000 chemicals in a cigarette, and then 69 of them are known to cause cancer, and then a significant amount of them are poisonous, so there's probably some consequences that we'll find out future of the 7,000, but 69 cause cancer. It's always a bad sign to have to do that.
When you really wrap your head around that, that's a lot of bad stuff you're putting in every time you smoke a cigarette. Okay, talk about the health consequences of cigarette smoking. We know there's much more than just a cough or just the possibility of lung cancer.
Well, the cancer is the one that people think of, but smoking is one of the main causes of cardiovascular disease, which includes stroke, heart attacks. People get vascular disease in their legs. So smoking kills blood vessels. I mean, that's the best way to put it. Some people are already behind on that if they have a family history of cardiovascular disease. They may have cholesterol might be high or low, but if you add smoking onto that, or somebody that's a diabetic, the possibilities of having more vascular disease or a heart attack or stroke exponentially increases.
Okay, and then as we talk about the dangers, there's people out there that are probably saying, you know what, I just smoke one cigarette a day. I just need one a day. I'm not really doing any harm.
So a new study came out in the England region and in Britain that showed that smoking one cigarette a day, just one, significantly increases the chance of heart attack and stroke across the board versus somebody that doesn't smoke. So the people that are saying, oh, I'm going to cut back. Well, cut back is good, but it doesn't cut the mustard. I mean, I always tell my patients, and I've been doing this for 20 years, I said, oh, you don't need your mama, your sister, your doctor to tell you to quit smoking. Everybody knows you need to quit smoking. You got to do it. You got to have the mental fortitude to do it, and it's going to be difficult to do. But I say, put yourself in the same realm of somebody that's quit drinking. You know, if somebody hadn't drank alcohol for 10 years, they want to drink every day. So if you quit smoking, you can still want to smoke. You just say, I want to, but I'm not going to do it.
And so you may have the desire, and there are some ways to help people that you guys as physicians can offer to patients.
Correct. So there's, everybody's heard about the patches. You get the nicotine patch to taper down, the nicotine gum. There's a couple of prescription medicines. One of them is the nicotine receptor blocker, which it blocks the receptor in the brain that says, hey, I want a cigarette. One of the first medicines that came out was Wellbutrin or bupropion that can also help too. So there are some options to help assist the process of quitting smoking, but the person still has to want to do it.
And as always, if you have any questions, you need help quitting smoking, you can always call the Baptist Health Line at 1-888-BAPTIST.